in the emergency department, in Orlando, the experiences we had are all been training drills. So fortunately, we haven't had anybody show up spontaneously, with the exception of someone covered in pepper spray, which we did have an experience with that, where the police had to basically, again, engage with a patient, contaminate him, and brought him into the department. So at that particular, we instructed him to come around the back door. Fortunately, we have a setup where we can leave the facility and not contaminate the whole emergency department, and come in through the back and enter our decon. We have 2 showers here. So we were able to do that and avert having to close down the emergency department. We've required all our staff here in the emergency department to go through first receiver decon training. It's a valuable program for us. We have carts and equipment and stuff like that. We have a different team as well. It's in this facility. It's called the Directors 50. They also participate for campus type emergencies when able to do so, if they're not tied up in the area where the emergency is. So they basically have their quick response equipment where we can run into the shower, their boots, their coverings and all that stuff to be able to. But the most important aspect of the first receiver decon training is the awareness of, don't let the emergency become part of our emergency department, right? So to make sure that if we're not sure that they're contaminated, let's go ahead and clean them off before we bring them in and lose our services and their capabilities there. Same with our Nurse First, is basically training them to make sure that they're aware if somebody comes in, like we had a gentleman presented, he covered himself with an insect repellent, right? So it was a whole jug of pesticides, and it spilled off a shelf, and he covered him from head to toe, and you could smell him coming in. It was a matter of getting him outside the ED and bringing him around back and being able to get him deconned before he contaminated. And he was fully exhibiting sludge, so all those symptoms were happening right there. So we had to protect ourselves pretty quick too, and still get them deconned. And the staff are trained for it, but it obviously takes a little bit of time to get prepared for those things, so they would have to shift on the fly. Most likely, if they come in through fire rescue or EMS, we're going to have heads up, and they'll probably do the level 1 decon out there first, and then we can follow up with that here. If they just show up because a friend brought them here, which sometimes happens, and they're contaminated, you just hope the right people remember the right things at the right time, and don't contaminate your department, but and engage as quick as they can. Typically, anything like that happens, they'll have to elevate to let leadership know that we have a contamination in the facility. As far as exercises, so we do the first receiver formal training about every 2 years. That's kind of the schedule we're on right now. And we participate in the community with all kinds of disaster drills. So we recently just completed a disaster drill, which did involve a decontamination incident, and so that we get to simulate those things. And I'd say twice a year we have some sort of community exercise where we're involved with that. So the staff do get to keep it on their front dashboard, so to speak, with the mindset. And then internally we do some TMS training, some regular training. We have some hazmat classes, and some of our folks are members of the D50, Directors 50 team here, which is a campus response team that basically comes in times of emergencies if we have to deploy somewhere else or do something. And so they stay up with their training with part of emergency management and their personnel as well. So, and then there's DEMPs. We have the DEMPs trained people too that basically hold their credentials and have to keep current with that.